What is autism spectrum disorder? Autism spectrum disorder, ASD, is a lifelong neurodevelopmental condition that influences communication, behaviour, and sensory processing. Autism can affect people in different ways. Differences in social communication, strong interests or focused hobbies, preference for routines and predictability, sensory sensitivities to sound, light or textures, repetitive behaviours or movements, differences in emotional regulation. Why autism often looks different in women. Autism in women can sometimes be less visible because many girls learn ways to adapt socially. Autistic traits in women may appear differently from traditional descriptions. Stronger social imitation and observation interests that appear socially typical. Internalised struggles such as anxiety or fatigue, difficulty interpreting social cues, higher ability to mask autistic traits. Common signs of autism in women. The signs of autism in women can vary widely, but certain patterns appear frequently. Some experiences commonly reported by autistic women include difficulty interpreting social cues, feeling exhausted after social interactions, preferring deep conversations over large groups, sensory sensitivities to sound, light or textures, strong interest in specific topics, preference for routine and structure. These traits may not always be obvious, which is why autism in women can sometimes be overlooked. Masking and camouflaging in autistic women. Masking refers to strategies autistic people use to hide their traits in social situations. Forcing eye contact during conversations, rehearsing or scripting social interactions, copying facial expressions or gestures, suppressing stimming behaviours, hiding sensory discomfort. While masking may help someone blend socially, it can also lead to fatigue, anxiety, and autistic burnout. Why autism in women is often diagnosed late. Many women receive an autism diagnosis later in life rather than during childhood. Several factors contribute to delayed diagnosis. Diagnostic criteria, historically based on boys' subtle or internalised autism traits, masking behaviours that hide symptoms, misdiagnosis with anxiety or depression, social expectations placed on girls. Because of these factors, many women only begin exploring autism after learning more about it in adulthood. Autism and mental health in women. Mental health is an important aspect of understanding autism in women. Autistic women may experience higher rates of certain conditions. Anxiety related to social expectations. Depression linked to feeling misunderstood. ADHD and attention differences. Obsessive compulsive disorder. OCD. Eating disorders influenced by sensory sensitivities. Years of masking or misunderstanding can affect well-being, which is why recognition and supportive environments are important. Getting an autism diagnosis as a woman. Many women begin exploring autism after recognising lifelong patterns in their experiences. An adult autism assessment usually involves several steps: speaking with a GP for referral assessment with a psychologist or psychiatrist, discussing developmental history, completing diagnostic questionnaires, clinical interviews and observations. Strengths of women living with autism. Autism in women is not only about challenges, but also unique strengths and perspectives. Many autistic women demonstrate valuable abilities: deep focus on interests and passions, creative thinking and imagination, strong attention to detail, high empathy and emotional awareness, innovative problem-solving abilities, honest and authentic communication, support and strategies for autistic women. Support strategies can help autistic women build environments that suit their needs and strengths. Many practical supports focus on comfort, routine and understanding, sensory regulation strategies for managing environments, structured routines and predictable schedules, therapy or coaching with autism-informed professionals, peer support groups and communities, workplace adjustments such as flexible schedules. How Affective Care supports autistic women. At Affective Care, we provide compassionate and personalised support for autistic women at different stages of their journey. Our team focuses on understanding individual needs and strengths, autism-informed psychological support, guidance for autism assessments and referrals, therapy tailored to sensory and emotional needs, strategies for managing anxiety and daily challenges, supportive and inclusive care environments, person-centred approaches that respect neurodiversity. Our goal is to help autistic women feel understood, supported and empowered in everyday